Right. Right. Great. Good morning. Good morning, everyone. My name is Mona Aika, and I'm a child. Can you hear me? There's a bit of noise.
Yeah, I'll just mute.
Good morning.
Yes.
Okay. Good morning once again. I'm Mona from UNICEF SRO, and I'm a child protection specialist. First and foremost, a very warm welcome to all the government representatives who are with us today. Colleagues from Changing the Way We Care, maybe they're already with us, or they'll be joining us soon. And also UNICEF child protection colleagues and the various CSO partners working in the area of care reform in the region and beyond. So a very warm welcome. Before we start, I'd like to go through some of the webinar protocols that will enable us to have a smooth and hopefully lively session. We are encouraging you to introduce yourself in the chat box, but also Bertha or Emily will send a link where you can actually introduce yourself through that link. We need to know who you are, the office you're working from, and the country that you're representing today. As part of the, in the course of the webinar presentations, we are kindly requesting you, dear participants, to mute your microphone during all the sessions. You're encouraged to type in the chat box any questions or comments that you may have, and we'll make sure that all the questions and comments are addressed. You may also use the raise hand button if you want to ask your questions directly. And as you've heard in the beginning, the webinar is recorded and will be shared after this session for your reference. And also, if you'd like to join the mailing list to learn more about future platform events, please complete a short Google form that's going to be posted in the chat box. Or you can also email Emily Dillap, we'll put our emails there, or myself, Mona Aika. So let me start by introducing this learning platform. Many of you already know the Regional Learning Platform on Care was established by UNICEF in collaboration with Changing the Way We Care. And the purpose of this platform is really to facilitate the learning from government, from care practitioners, from UNICEF staff, to share learning from each other on care reform. We are now in phase 2 of the platform, which will be ending in January 2023. Hopefully we'll be able to continue this platform to phase 3, so that we can continue the learning. So the actual part, the webinar today is on lessons learned on care reform in Eastern and Southern Africa from COVID-19. Many of you may recall at the onset of the pandemic, all pretty much services, social services, the care for children was disrupted. So we will be able to hear from different experts. We'll start off with Emily, who will provide a presentation, mainly focusing on lesson 1, improving the care of children. And then she will be able to give a few examples that have been documented from this region. Also, Emily will present on care reform must be based on clear understanding of often rapidly changing context. So there in her presentation, you'll be able to hear some key messages coming out, and also how to ensure, future proofing of care reform can be developed, including the strategies to be used. Following Emily's presentation, we'll hear from, I think, Habiba or Osman. Emily, you can correct me, from MHRC, who will give an example from Malawi Human Rights Commission on understanding the residential care during the pandemic. So you get to hear some live examples there. After that presentation, we'll have a little, questions session, which will go directly to the Malawi Human Rights Commission. After that, we'll then hear back from Emily, who will take us through the remaining lessons. As you heard, there are 9 lessons altogether. So Emily will take us through those remaining lessons through that. And then there'll be an example coming from Uganda on remote support to social workers from CRS Uganda, and hopefully we'll have Barbara Abba to present. And then we'll finish up with all the remaining examples. And then another example will be presented from Kenya by Changing the Way We Care, or also maybe the government of Kenya, and possibly also Catherine Kimotho of UNICEF Kenya Country Office. And then we will finish up with the remaining lesson, and then we'll have a Q&A session for all participants to be able to ask. You can ask questions and have a discussion after all the presentations. So without further ado, let me now pass the floor back to Emily to take us through the first presentation. Thank you.
Thank you so much, Mona. As Mona mentioned, we're going to do a kind of format today where we're going to do a presentation followed by pausing to ask for some examples from some of the different countries across the region, and then continuing with the presentation. So great if you can just save all your questions to the end, but if you want to type questions as they occur to you, just put them in the chat box and we'll come back to you right at the end. So just starting off with the first example, first lesson learned. So there are 9 lessons learned, and just to explain that these lessons have been drawn from the literature, but also I did some key informant interviews from different examples around the region on the impacts of COVID on children's care. And what I was really trying to do with this piece of research is trying to focus less on all the challenges and problems that were faced during the really difficult period at the height of the pandemic, to try and understand what we've learned from the pandemic and what are some of the positive learning that have emerged from this period. So hopefully that comes through in the presentation. So the first key area of learning was that improving children's care has now become an even greater priority. And this is for several reasons. Many children have lost caregivers. So globally, 6.7 million children lost a parent or caregiver due to COVID-19. And these figures were collected quite recently, but there's probably an even greater number now. And 12 of the 25 countries with the largest numbers of COVID orphans are in Eastern and Southern Africa. And when we share the publication, you can see a full list of those countries. So, for example, in South Africa, 1 in every 200 children experience COVID-related orphanhood. And they defined orphanhood quite broadly in this study. Mostly it related to children losing one or more of their parents, but in some cases it also related to them losing another caregiver, such as a grandparent. And this statistic surprised me, but the speed of loss during COVID-19 is quite unprecedented. So during the HIV pandemic, it took 10 years to reach 5 million orphans. And during COVID, it took 2 years to reach a similar figure globally. So you can see that the rate at which children are losing caregivers is very dramatic. We also know from multiple examples across the region that violence in the home has increased. So just to give you one example, in Uganda, there was a 13-fold increase in calls to a child helpline, with many of these calls related to violence in the home. And there are lots of other examples from other countries in the region. And then the quality of care, as well as this issue with violence in the home, other factors related to the quality of care in families have also been impacted by the pandemic. So as I'm sure you're all familiar with, caregivers have really struggled with school closures, high stress levels. We know that domestic violence, particularly violence against women, has increased. And there is some evidence of caregivers being less attentive and less responsive to children's needs just because of the huge burden that's been placed on them. We also know that the quality of care in residential care has declined. We know that regular monitoring visits, for example, stopped during COVID. Funding to facilities has also fallen, particularly and this has particularly impacted smaller privately run facilities. Providers across the region have received limited guidance and support on how to cope. So there's some quite interesting evidence from South Africa, which shows that there was some sort of health-related guidance given to residential care providers telling them how to stop the spread of the pandemic, but in other aspects of the care, they received very little support and guidance. And children were either rapidly reintegrated, and we're going to come on to the problems associated with this rapid reintegration later on in the presentation, or they were sent, or they remained in facilities, kind of trapped in facilities with very limited contact with their families, which obviously had a huge impact on their well-being. So not only is the quality of care and residential care declined, but also the care choices available to children have reduced. So many foster carers have felt unable to continue caring for children because of the challenges associated with the pandemic. And extended families have also struggled in providing support to children. And we think that this has led to more children being pushed out of families into work, being trafficked, and into marriage, where obviously they have no adult care at all. And unfortunately, these impacts won't end with the end of the pandemic, whenever that may come, because it's still very much present across the world, as you know. The trauma that children have experienced because of the pandemic, we know will have a lasting impact throughout their lives. Relationships that have been damaged, for example, children who have not been able to have so much contact with their parents will need to be rebuilt. And COVID is also having a lasting impact on factors which lead to separation from families and violence against children. So, for example, households have lost assets and savings, which will increase poverty in the long run and mean they're less able to cope with shocks, maybe more likely to send children to live elsewhere. And we also know that children who drop out of school because of factors such as COVID are less likely to return to school, and education has a major impact on children's care. Okay, so I'm going to talk you through this second example, and then we're going to go to, the second lesson, and then we're going to go to an example from Malawi. So the second lesson is care reform must be based on a clear understanding of often rapidly changing contexts. So during the pandemic, we saw how quickly the care situation for children changed. And it's likely that other global trends, such as climate change and associated rising levels of conflict, will lead to similar impacts on care. So if we want to future-proof the care system, it's very important that we try and predict, understand, prepare for, and monitor these changes. And this list that I've provided on this slide is some of the areas that we need to really keep an eye out on as the context changes. So the availability and capacity of social services, the formal systems of child protection and care, the social norms and community mechanisms, factors that affect family separation or inadequate care within families. So, for example, if poverty levels are rising, if levels against violence against children are rising, if there's divorce, separation in families, all of these factors can lead to an increase in poorer care within families. And then we need to consider the situation of particularly vulnerable groups that are particularly prone to inadequate care, such as those with disabilities. So what I'd like to do now is introduce you to Michael Mprembe from the Malawi Human Rights Commission. Michael, if you're able to just say hello.
Oh, hello, how are you?
Good morning, Michael. It's really great to have you with us.
Thank you.
The Malawi Human Rights Commission did a really fantastic job during the pandemic, carrying out first a rapid assessment, and then they did more in-depth research on the situation of children in residential care. So Michael, yes, just turning to you, could you tell us first of all why you felt this research was necessary?
Oh, thank you so much. As you are aware, Malawi Human Rights Commission is one of the constitutional body which is mandated by the constitution to investigate as well as protect human rights in the country. So we have that mandate, and so after the images of COVID-19, we noted that as you are aware, I think there was a general disruption in the way people's lives were maybe changed in terms of everything. Our way of life changed with the COVID-19. So for the commission, we thought it wise that we should at least try to monitor and understand the situation of children in the alternative care, because we noted that the measures that government had introduced were having an impact in a number of in the way of life of people in general, but also in the children, the vulnerable children, and that includes the children under residential care. So what we did was to first do a fact-finding mission. We targeted all the regions of the country, all the 3 regions. We sampled some institutions just to understand, just to have an understanding, a quick understanding of the situation. And from what we noted from this quick fact-finding mission is that most child care institutions, residential care institutions, were reintegrating the children without following proper procedures, but also most of these measures that were introduced were having a huge impact in the lives of children. So in this quick mission, we also noted that children's return to their families in the communities was done without proper preparation, and also there was no kind of any aftercare support. So that to us was kind of a red flag, and we needed a comprehensive kind of monitoring in order to have a comprehensive understanding of the situation, but also be able to advise government to produce recommendations, evidence-based recommendation that would inform government's action. So following this quick fact-finding mission, we then carried out a nationwide exercise, and this was funded by UNICEF. And we targeted all the childcare, most of the childcare institutions in the country, and around over 100, which is around 122 childcare institutions. And from what we found is that we noted that childcare institutions were hugely affected, and the lives of children, the quality of care of children in these CCIs was hugely affected and impacted. The number of staff, for instance, the caregivers reduced, went down, and this was due to scaling down of the operations of some CCIs, but also the introduction of some shifting and the like. We also noted that there was a reduced contact between the children in the residential care and their parents. Remember, after the introduction of these measures, children were not allowed to visit their relatives in their homes, or maybe the relatives visiting the institution. So this visitation was in one way restricted, and this affected the bonding as well as the interaction between these children and the relatives in the community. We also noted quite a huge disruption in the access to education, because most of the children that were in the CCIs, some of them continued learning, but some were sent back home, and this affected the operations, but also access to education for the children. And remember, there was prolonged closure of the schools. So that means children's right to education was impacted. We also noted weak coordination between residential care facilities and the social welfare offices. So the social welfare offices were not able to visit most of these CCIs because remember, there were restrictions, and so social welfare operations were also crippled, and there was no any noticeable kind of monitoring between these by the social welfare office. This means most of the initiatives that the child care institutions were, residential care institutions were undertaking were being done without proper guidance and without involvement of the social welfare offices. There was also an increase in the violence against children. at least from our monitoring exercise, we noted that around 100 something children were dropped out of school due to early pregnancy, due to pregnancies, and also some of them were married off and all that. So that signaled one of the negative impacts of the COVID-19. But apart from that, we also noted that the children that were integrated during this period, there wasn't any form of aftercare support that was provided to them. As a result, most of these children that were integrated ended up dropping out of school if they were in schools. Some of them ended up begging the same institutions to return to these institutions. And apart from that, we also noted that some of these children that were integrated during this time were even rendered more vulnerable than they were in the residential institutions. But most importantly, we also noted that there was a decline, a huge decline in the financial capacity of most of these child care institutions. And from these are just some of the findings, some of the key findings that we established as Malawi Human Rights Commission. From there, we came up with some recommendations, and some of the recommendations include that we wanted the Minister of Gender and in collaboration with the Child Case Review Board to do a follow-up of the child care institutions that were financially crippled due to the coming of the pandemic, to make sure that some of the children in those CCIs maybe assessed and then maybe reintegrated to the community, or maybe transferred to other institutions, temporarily transferred to other institutions, to make sure that the quality of care is being taken care of. We also recommended that there is a need for government to scale up some economic assistance programs to vulnerable families, because this will at least contain the problems that children are facing in the community that render them into situations of vulnerability that will create the need for them to be institutionalized. So if government can scale up some of these economic assistance programs, such as social, like here we call it Ntukurapakomo. We wanted the government to link the social protection programs with the reintegration program, because currently what is happening is most of the children that are being reintegrated into the communities, and the social there is a delink, kind of a delink, and this is rendering these children into vulnerability and all that. We also recommended that the government must improve the data management system in the alternative care, as we are currently our CPIMS, the National Child Protection, the data management system doesn't include the data on children in alternative care, and that is a problem, and that is quite a problem when it comes to the reform agenda on alternative care that we have currently. So in brief, I think these are some of the recommendations.
That's fantastic. Yes. Thank you so much, Michael. That was a really helpful introduction. And if anybody has any questions, please just type them in the chat box and we'll come back to them at the end. It's going the wrong way. So the third lesson that we learned was around the fact that children's care must be considered in preparing for future pandemics and other emergencies. So we saw during COVID that there was a tendency for government to focus all or the majority of their efforts on the health ramifications of the pandemic. So stopping the spread of the pandemic and dealing with those that were unwell as a result of the pandemic. And child protection impacts were neglected, or in some cases they were inappropriately addressed in a way that increased harm. So for example, we had children being confined to their homes, but social workers not able to reach them. And that meant that often children were being trapped with their abusers and making them much more vulnerable. And this was one example of the lack of consideration of child protection in the way that the pandemic was dealt with. So this suggests that in the future, we really need to take some steps to address care and protection in the emergency preparedness and emergency response. And I've given some examples of how to do this here, and in the paper, which we will share with you shortly, there's lots of links and resources related to each of these examples. So the first thing we need to do is put in place measures to prevent family separation. And I think Michael gave a great example of this in his presentation around the importance of linking social protection to care, so that those that are vulnerable to, oh, sorry, just let me mute a couple of people. Okay, so that we can ensure that those that are vulnerable to separation are receiving the right kinds of supports. Mental health supports, child helplines, psychosocial supports, parenting supports, they can all help prevent family separation during emergencies. Ensuring that the legal and gatekeeping mechanisms can still function, so decisions can still be made around children's entry into care and the types of support that families should receive, even during an emergency such as a pandemic. So for example, in some countries, these mechanisms were put online, so they were still able to continue. Ensuring that there is still a wide range of support so that children could have a range of care choices open to them. Obviously trying to promote and prioritise support to family-based care, so support to foster carers, for example. Prioritising support to kinship care. So we saw in the pandemic that many kinship carers are grandparents and therefore particularly vulnerable to COVID-19 and needed extra help and assistance. And that is also the case in many other emergencies. Provide guidance to foster carers and residential carers, steps to reduce the spread of COVID in care homes, or extra support to foster carers, and also guidance around safe reintegration, which we're going to come back to in more detail later on. Providing additional supports to families to stop this deterioration in children's care that we saw. So this might be support to parenting in addition to material supports, which is really what is most needed. Ensuring that social workers can carry on working, so ensuring that, as I think Michael also brought this up, and it also will come up later when we go back to talking about Malawi, about Uganda, that social workers are recognised as key workers and they're allowed to carry on working, and that they receive some guidance on things like remote case management. And luckily we have a lot of that guidance now, so if this happens again, we've got a lot of guidance to draw on, and changing the way we care in Kenya in particular. There's developed some really great guidance which is available in the report, which we'll share with you soon. And provide support to especially vulnerable groups. And one person actually asked this question in the chat box around what do we mean by especially vulnerable groups? And in the context of care, anyway, we see particular vulnerability in relation to children with disabilities, refugees, and children that are connected to the streets. I'm sure there are other vulnerable groups as well, and I think that really varies by context. Okay. So the pandemic highlighted the very strong links between poverty and children's care. And I think it showed that material needs are the kind of priority area of support for many families who went through this pandemic. We found not just in East and Southern Africa, but elsewhere in the world, that families found it very hard to engage with other forms of support, such as parenting programs or case management supports if they were really struggling to get enough food on the table and were worrying constantly about how much to eat. So having that social protection support is kind of really, really essential for enabling those other mechanisms to work. And social protection, we know, is most effective if there is a cash plus element to it. So it's not just money, but it's also other forms of support. And that might be parenting supports, awareness raising, referrals to other services. And we've seen in many countries that are already implementing those cash plus programs that had to make adjustments because families' needs had changed as a result of the pandemic. And again, there are examples of those adjustments in the paper that we're going to share with you shortly. We also need to recognise the linkages between care and education. The pandemic really confirmed this. School closures put a huge pressure on families, resulting in poorer care, often within the home, as parents really struggled to deal with having to look after children, as well as perhaps having to try and get enough income. We know that school closures are also closely linked to family separation and children being sent to residential care, for example. So we know that, we already know that collaboration and cross-sector working is really essential for care reform processes, but the pandemic again really reiterated this issue. So collaboration with the health and education and social protection sectors was really vital for addressing care issues during COVID-19, but this wasn't a one-way relationship. It wasn't just that those working on care were reliant on other sectors were also reliant on those working with care. So we have examples from Uganda of social workers who were working around reintegration and supports to families to prevent separation. They knew who the most vulnerable were in their communities, and they were able to rapidly reach them, and they were used by health workers to share messages and to provide material assistance to identify those most in need of social protection, for example. We know that it's very important to have some form of coordination bodies that can work on care and protection issues. It's better if these coordination bodies are established during normal periods, but it's very important that they can continue to function in emergencies such as a pandemic. Right, I'm going to give one more slide, and then we're going to go on to another example, this time from Uganda. So the sixth lesson that we've learnt is that there were many innovations that came up during the pandemic things that we've learned how to do things differently in relation to how we deliver support around children's care that we feel can be continued after the pandemic. So I'm going to give some examples here. In Kenya, they managed amazingly to carry out a very complicated participatory process, learning process around their care reform 10-year strategy, involving hundreds of different participants, including community members, and to develop this strategy, draft it, get comments back on it, almost entirely online. So the original plan had been to do all of this face-to-face, and the pandemic hit, and rather than pausing that very important process, UNICEF, the government of Kenya, decided to continue with that process and find a way to support that online, and they succeeded. And I think they found that there were some advantages to working online because it meant that they could consult much more widely across the country. So perhaps in the future, that's something that other policymakers might consider doing as well. Social workers can be supported virtually, and indeed during the pandemic it was really essential that they continue to have some kind of workforce strengthening and support. And we're going to come back to an example from Uganda on this in a minute. Parenting programs can also have a virtual element, so there was lots of innovation in the region around using WhatsApp groups, making phone calls, and also having some messaging, some ideas how to keep children entertained, etc. on TV and radio. We found some aspects of case management can be done online, but I want to reiterate some aspects, not all aspects. So, for example, some aspects of risk assessment, some support to reintegrated children, particularly when reintegration has taken place over a very diverse area in very different bits of the country, often to remote areas. It was in fact a real benefit to do some of that case management online because it meant that they could have more frequent contact with the children and the families. I think what they found is that not all case management can be done online, and in more complex cases, where there's risk of violence, there is no way to assess if that violence is happening without a face-to-face visit, because there's no way to ensure that you're speaking to a child confidentially and to build up a rapport and relationship with that child so they can speak to you honestly. So it was still essential that social workers were able to travel and carry out some of that face-to-face work. For this virtual work, it's very important, this may seem obvious, but it does affect budgets, so it's worth highlighting it, that people have the devices that they need to carry out that face-to-face work. So organisations found that they sometimes had to provide mobile phones or tablets, but also data. It's very important to give people enough data so that they could carry out that remote work, and also to provide them some of the skills that they needed to learn how to use a Zoom call. And this included social workers and those working in government, who I've noticed across the region are now very effective in using these remote mechanisms, but perhaps before the pandemic just didn't have so much experience in doing them. It's very important to be aware of the context in which you're carrying out the remote work and to be sympathetic to that context. So to recognise that social workers or families that you're speaking to may be in very busy homes, have a lot going on in the background, have kids they're trying to look after, and they may have very limited privacy as well. So just to be aware of that in this remote work. And as I've mentioned already, there are limits to what you can do remotely. And face-to-face visits always need to be used in more complex or high-risk cases. And it's important that we designate social workers as essential workers so that they can continue to be able to do some of their work. So I'm going to introduce now Barbara Aber, who is from Catholic Relief Services in Uganda. And hi, Barbara, good morning. And in Uganda, Catholic Relief Services developed some really innovative ways to support government social workers so they could continue with their work and continue to learn during the pandemic. So Barbara, can you tell us a bit more about how you supported social workers remotely during the pandemic?
Absolutely. Thank you, Emily. CRS, just as the pandemic hit, was implementing a project called For Children. This was a project that was partnering with the government to support child protection system strengthening in the country. And with the pandemic, we really sought to continue reinforcing government leadership through data-driven decision-making amid the pandemic. I think it became even more important to use data to drive some of the decisions we made. And we quickly found out that this required different types of data. For example, we realized the importance of highlighting the role of social workers during health pandemics, for example, to highlight how the workforce was continuing to work amid the pandemic. To highlight the data, to highlight the increasing number of children, of child protection and domestic violence cases coming up, and the need to really recognize social workers as an essential workforce amid, especially when planning for responses with respect.
Oh. I think we may have just temporarily lost Barbara there.
Virtually.
Carry on. Sorry, we just lost you for a second there, Barbara.
Cases.
Carry on, please.
Sorry, can you hear me?
We can. Okay. Yes. I think
Yeah.
it might actually be my internet connection, so apologies for that. Please carry on.
No worries. So like I was saying, we really collected data on a couple of things, and we worked with government social workers to collect and collate key information virtually on protection issues that were coming up. The data from this rapid review, not surprising, indicated that there had been an increase in reporting of child right violations since the government mandated lockdown. For instance, the data demonstrated that the workforce had handled nearly as many protection cases in the first 3 weeks of the government lockdown than they had handled in a previous 3-month period. So this was really indicative of the need to work with social workers on the ground, that they needed to be recognized as an essential workforce, and that they needed to be supported to respond to these issues. So this data was used by the Ministry of Gender to advocate for the recognition of government social workers as an essential workforce, and they need to include them in the COVID-19 response planning committees. As CRS, as a project, we collected that data, but we also realized we had to make adjustments to rapidly shift our mode of technical assistance to the government workforce. So to facilitate them to continue monitoring and supporting the child protection response. This included, for example, having weekly phone check-ins with specific probation officers, supporting the workforce to set up WhatsApp groups among us, both within districts and across districts, sending out regular emails and text messages on updates, on key updates, on key information that they needed to plan their movement. We also supplied the workforce with mobile data, like you indicated, to enable them continue working remotely. And all of these things were also possible because one of our key interventions prior to the lockdown was provision of Android tablets, Android devices to all the probation officers in the country. So they had the devices, but didn't have, for example, data. They didn't have, some of them needed extra tutorage on how to, coordinate response remotely through WhatsApp groups, through coordination groups, and and in this we provided them with, for example, phone contacts of all probation officers in the country, so that they could even facilitate cross-border management of cases of all police officers within the Child and Family Division, so they could make phone calls to rapidly manage some of the cases that they were dealing with. We also worked to create peer-to-peer and small group support discussions through telegroup conferences. We also supported the ministry to also provide their technical assistance remotely by identifying probation officers that needed extra technical assistance on specific areas. So we grouped them and we grouped them and identify and worked with the ministry to identify technical experts to help them troubleshoot some of the challenges that they were facing. So those are some of the adjustments and the ways we supported the government to work remotely. And these small program investments, some seemingly small program investments like the provision of data, enabled the workforce to continue serving vulnerable children. And a lot of them told us how they didn't realize that they could even work without being in their offices, for example, because they were receiving cases in their homes. They were having to take case notes, for example, in exercise books. Some were saying we had to take case notes and exercise books for our children, but we kind of taught them some basic skills to use electronic devices to do some of this work.
Yeah. Fantastic. Thanks so much, Barbara. That's such a great example. And do you know, or do you think any of these innovations that occurred during COVID are going to carry on now that the pandemic is having less of an impact and we're not forced to do so much remote working?
Yes, I mean, things like WhatsApp groups remained. We are seeing a lot of coordination happening in these groups. The peer-to-peer support groups that were created still continue to this day because we identified senior qualified probation officers and linked them to less qualified or newly recruited probation officers. Those relationships have continued, and we're told those communications, those conversations still happen to this day. The government as well kind of realized that they didn't have to always go to the field to provide assistance to the workforce. So we're seeing more and more them organizing these telegroup conferences and having those one-to-one conversations and group-based mentorship sessions with the government. We're seeing coordination across stakeholders working through those groups. So I want to say that yes, these innovations, these modes of virtual working still work to this day, because even though there is a little bit movement, a little bit of freedom to do a lot of these things, some of these virtual methods have allowed us to work smarter, some would say. So yeah.
Fantastic. Thanks so much. It's great to hear, although it was such a difficult time, it has led to some improvements in the way that we're supporting social workers. And I know there are multiple examples of other areas where things have improved as a consequence of innovation during COVID as well across the region. And very impressive as well how rapidly people adjusted and adapted to something that they'd never done before as well. It's quite, also that's a lesson for us all, I think, is that we can change and adjust. Yeah. Okay, thanks,
Absolutely.
Barbara. Thanks so much. That's really helpful. We're going to go on to the 7th lesson now. Oh, sorry, it's gone backwards rather than forwards. Okay. So the 7th lesson is the importance of investing in community volunteers, structures and caregivers. So in emergencies, we really need to understand and build on the role that is already being played by communities in responding to those emergencies and in supporting and protecting children's care. So the role for paraprofessionals, so volunteer social workers such as the ISU in Rwanda, became even more important during the pandemic. So social workers often, especially initially, when they weren't being recognised as essential workers and there were restrictions on their movements, they couldn't reach vulnerable families. So these paraprofessionals that were located within the community, in Rwanda, there are 2 of these ISU, which means friends of the family, located in each village. So 2 volunteers who work to support families and children in each village across the country. So they're really spread across the country. They were able to reach out to families. They could do socially distanced visits, so perhaps seeing somebody outside of their house, and just check that everything was okay, and then make referrals to professionals if necessary. We also know that community structures are often used in addressing violence against children. So, for example, that might be structures of community elders that are convened to make decisions about how to respond to an incidence of violence against children and violence in families. And we know as the social work and the justice system shut down or were able to do less than before, then these structures became even more important and were used even more widely. And there's some examples from refugee context that we give in the paper that we'll be sharing with you shortly. So it's very important to ensure that these structures are working in a way that protects children, because they are the kind of go-to when other structures, formal structures, fail. And indeed, they're often the go-to structure even when formal structures are in place. And finally, we know that kinship care is always the primary response to family separation across Eastern and Southern Africa, and indeed across the world. But it became even more important to support kinship care during the pandemic. And particularly, as I've mentioned, as many of the caregivers are elderly and vulnerable, and were particularly vulnerable to COVID-19. So there was the need for extra supports for those groups. Okay, I'm going to give one more slide and then we're going to go on to one more example. Adequate supports are needed for effective reunification of children from residential care. And COVID-19 also offers us a chance to reduce reliance on residential care. So many governments across the region issued directives stating that residential care providers should send the children in their care home, not as many children as it was safely possible to do so. And this often led to very rushed reintegration processes. So there's some research from the region and globally which shows that often these providers had less than 2 weeks to prepare children to go back home. So they may have been separated for many years. And these providers felt it was insufficient time to do proper assessments, to address the root causes of original separation, and to rebuild damaged family relationships. And obviously families were already struggling, and this sudden addition of an extra mouth to feed in their homes made it even harder for them to cope. And social workers couldn't follow up. As the pandemic was put in place, we saw anecdotal evidence of how this situation improved, and some measures were put in place. And this really confirmed the importance of proper reintegration supports. And I'm going to talk about this in a bit more detail in relation to Kenya, but I just wanted to talk a little bit about the second bullet on this slide first. So the rapid reintegration of children and the lack of funding going into residential care. So many residential care providers had reduced funding because everybody was less able to donate money because everybody was suffering. And also because there was a reliance on the region and elsewhere in the world in volunteers coming to work in residential care facilities and paying for that work, and that's often used as a funding stream. And these were foreign volunteers, so that funding stream just completely dried up when travel restrictions were in place. So for these two reasons, some residential care providers are starting to question the value of residential care and starting to think about how they can shift their services to other forms of support. And we don't know how widespread this shift is, but we do know that the window for reform has opened at least a little bit, and we need to, maximise this opportunity that we have at the moment. Right, I now want to introduce Khadija Karama. Hi, Khadija, are you there?
Hi, everyone. Yes,
Hi.
I joined. Apologies, I joined a little bit late.
No problem. So Khadija is with CRS and Changing the Way We Care in Kenya. And she's going to tell us a bit about what happened during the pandemic. In Kenya, a directive was issued in March 2020 that applied to residential care facilities, but also all sort of residential facilities across the country, so boarding schools and other types of facilities as well. And children were only allowed to remain in care homes if they had no family to return to, or if there were really serious concerns about their safety. So it led to very rapid reintegration. And we think over half of the children in residential care returned to their families. So although this process was initially very rushed, government and their partners, including UNICEF and CRS, Changing the Way We Care, quickly realised that families needed extra assistance and put some measures in place. So Khadija, could you tell us what happened to these families who went back home? What problems did they face, and what work did you do to try and address some of those problems?
Yeah, thank you so much for this learnings forum. And before I just begin to share our experiences from the perspective of Kenya, especially on Changing the Way We Care, which is a consortium of both CRS and Maestro, I would want to recognize the presence of my colleague in country, and that's Catherine Kimotho from UNICEF Kenya. And we have also Arnold Mwanake, who is representing the National Council for Children's Services. So
that's fantastic, Khadija. And we can, I was going to ask Catherine and Arnold if they'd like to come add to anything that you say after you've spoken. So that's great that we have all three of you on the call.
Sure, thank you so much. So we, just like the way we do it in Kenya, it's collaborative, is multi-sectorial. We work as partners. So I'm sure Catherine and Arnold would find some time to really speak through from our experiences. So yeah, just like any other country, it was not an easy time with the rapid release as a result of the direction from government. Just like the way you put it, children and families had less time to prepare for the process of moving from institutional care to the families, but then they had to go. So we saw downside of that, and we also saw we could also speak about some positive things that happened as a result of that rapid release of children as a result of COVID. So one of the things that we experienced is the lack of preparation really had a huge impact in terms of how the families and children settle in, because they are not prepared, they were not ready to receive these children. It was like a shock for them. And that is when we also learned that as part of the process of reintegration, preparation is very critical for us to ensure that we have sustainable reintegration. So one of the things that we saw as an outcome of this rapid release is that we had re-separation of some of these children who were taken back as a result of COVID, when the protocols were somewhat loosening and some restrictions were lifted. We actually saw a good number of children going back to the institution, which then results to reseparation. And we know that reunification or placement and then another reseparation also is not a good thing for children. But then there are good reasons as to why this happened. You'd find in terms of finances, majority of the family members would tell you, unfortunately, I'm not prepared. I wasn't prepared, as much as it is their child, whether in terms of kinship, and we saw a good number of children going back to kin. The other thing that we also saw is a good number of these children were going back to caregivers who are elderly. They're going back to either live with their grandparents, and it was really not an easy time for them. One of the other things that really pushed for the reseparation is the issue of school. One of the reasons why the children were there is because of education support, and it would have affected especially children who are transitioning to the next grade, and it was not easy for them, for families to find schools within that period, because it's like you're transitioning from lower primary to upper primary, and there's no way you could really have that happen within that short period. So they had to go back. So in general, there were a lot of reseparation, and we had to quickly learn through and figure out what exactly are these issues. So if it was about transitioning from one level of education to the other, we really worked through with the families to now ensure that by the time the child moves to the next grade, working with them to ensure by the time they're done with that particular grade, they come back home and now continue, with their school within where they've come from. And we also have a good number of such cases where they really went, but then came back to the family. We had issues of death, which was really contributed to COVID. The stigma that was associated around COVID, related to COVID, the lack of knowledge in terms of how to really go around COVID. So we could, I could give examples of a few cases where we had grandparents passing and children really left without a caregiver. So that was also another challenge that we really saw. In terms of follow-up, so what we did as a country, and of course we did all this work in collaboration with UNICEF, realizing, because we had two levels, we quickly went out to do two levels of data collection, where we wanted to understand the situation at the institution, and we called it level 1 data. And then we also went down to collect data to understand the impact of COVID on children. And we were able to realize what are some of these needs, both at institutional level and at the family level, which helped us to really shape our programming to suit the COVID situation. And I know Catherine will talk about the Cash Plus and how UNICEF came in to support that, and how changing the way we care with the little funds that we have. We also contributed to really cushion families with those emergency need that they needed, so that they are not, they continue to stay with the children now that it's an opportunity that they're having their children there. The other thing we realize is, as a country, we have the National Case Management for Integration guideline. But then when you look at it, it was not really suited for the emergency situation then. So we had to quickly figure out how to adapt that guideline to suit the situation at hand. And what we did is we quickly followed the children at the household, did some quick assessment to see what are some of their needs and how to provide that support. Parenting was one of the key things that was coming out as a need. Issues of cash transfer was also one of the things that really required by the family. Issues around life skills for children, in terms of how now to really fit in within that short period of time. But I would say this data really helped us to shape the way we would really support and cushion families as a result of this rapid release. Then just a couple of things around working with the social workforce. I know it was also that time when they were not recognized, but I think government also really helped us to ensure that, you know, the frontline workers, the child protection workers who are at the field, government officers, the children department, and all the other government officers were really, you know, provided with support in terms of how to better support children and continue supporting them during this period, but also making sure that the workforce is also protected. So as a country, we adopted what we called virtual monitoring that really made sure the workforce, the social workers, you know, who were actually in close contact with the families, they continue to follow on. Because one of the things we realized was issues related to abuse happening, you know, child protection issues, especially in terms of abuse, support for education, among other. And we wanted to ensure that the social workers and the workforce really keep in touch. So we tried to use that. It was like a piloting of the virtual monitoring of children. And I think it's something we learned through, and we realize it's something that can also be used outside emergency situation. So basically, that's how the situation looked like. It was not difficult. The needs were actually evolving. We had to sort approvals for us to really change the way we had planned originally to really make sure we support these families. The good side of this, I would say, is that some of the institutions learned through this, and they took advantage of this rapid release to actually shift from institutional care to now supporting community-based care support. So we have a couple of institutions in different counties where we are in, who, as I speak right now, have actually started the process of transitioning from being an institutional care provider to now making sure they do community-based. And I think it was, I always say, a blessing in disguise, and you know, like learning by fire. But I think it was also something that they appreciated, that it is possible to actually support children while they're at home, and they're better cared for while at home. However, there are things they're learning in the process, and making sure if we are changing our system, what are some of these things we need? Like, we need more social workforce to ensure monitoring is done. We need to bring in our donors to explain what it means to care for children in the community, the value of their money, you know, because they would always tell us, you know, the donor really wants to see children in one place, but they've gone ahead to say, instead of your money being used to support a child, they're actually supporting more than 5 family members in the community. So that's something we saw, and we were really happy to see that some of these institutions really took up that as an opportunity to test community-based care support services, which really worked well for them. So allow me to stop there and probably call on Catherine and Arnold to really add on to anything that I might have left out into this discussion. Thank you.
Okay. Sorry. Go ahead, Catherine, please. Yeah, we'd really love to hear from Catherine and Arnold as well.
Okay, thank you. And sorry, I think that is taking quite some time, but thanks to Khadija. And maybe just to say that for Kenya, the COVID came in when we had quite gained some momentum on care reform work. And as you said, we were at the beginning of developing the care reform strategy. So the good thing is that we had a team already in place led by National Council of Children's Services and Department of Children's Services. So that was really quite good, and it helped us in moving this forward. You asked a question about what happened to the children who went home. And I think Khadija has quite covered a lot, but the number we had for Kenya with the data that was collected, the one she mentioned, level 1 and 2, which was rapidly done using the structures of government and their relationship working with institutions, was that about 29,000 children, 13,758 children were released back to families, while about 15,000 remained in the institutions. We know that number was quite low because that would total to 29,000. And the numbers that we had in what we call charitable children institution, or CCI, is about 45,000. But that's the data we were able to gather. So clearly pointing to the challenge that the country had in just tracing where these children went to. And I think for us, one of the lessons that was learned was, as you said, was Emily, the importance of having the systems well strengthened to be able to respond to any pandemics when they come. The fact that the children went out very rapidly meant it was quite a challenge to know where they have gone to. And so this quick, very rapid checking on them. And also tied to that in issues of system strengthening was the CPIMS. I think I had Malawi mention about CPIMS. Luckily in Kenya, we have some data of children in institution in CPIMS, but it's not well covered, and that's a focus that we are having. That I think we learned from COVID, the very importance of knowing each and every individual child who is in residential care, and when such a pandemic comes, being able to account for them. I also want to emphasize the challenge we had about the lockdown on some of the government officers being declared as essential services. And of course, we know in all countries in the world, these were mostly health workers, and social workers in Kenya, specifically children officers, were not among this group. And this was really quite a challenge. And just like you said, in Rwanda, the community mechanisms was activated. For Kenya, it was the activation of community, we call them child protection volunteers. They are under the structure of Department of Children's Services. And this was the only group that the government could easily rely on, and even partners like UNICEF, Changing the Way We Care, and other NGOs that were in the process. So that was activated with the money that we had. We covered a few counties just for them to be supported to check on the children. Where were they? And were they well settled? And also tied to that was the cases of violence against children, which was on the increase for all those in residential care and the children who went home because there were no schools. Of course, there was that outcry of increase in teenage pregnancy. I will mention about the cash transfer. The government of Kenya really put a lot of money for social protection for COVID response, again, just like in many other countries. And of course, this was done in an emergency situation, trying to build on the structures that exist on social protection, but it was not as smooth as it should have been. So there was kind of observed challenges in coordination of social protection by government and partners. And partners also included a number of UN agencies and NGOs, including, of course, Changing the Way We Care and UNICEF. And jointly with Changing the Way We Care, we were able to cover about 3,848 households, giving them a cash transfer that depended. For UNICEF one, we built on the government structures that has a specific amount of money equivalent to like $23 per month. So we built on that and we gave similar amount. And for Changing the Way We Care, they did a family assessment for the cases they were able to support. I think out of this is that we were able to introduce the issue of social protection within care reform work in Kenya. And that is work that has continued even after the COVID. Okay, it's not after, but with the slowdown of the COVID. So that is an area that has been taken forward even as we settle down. And for the children, I think we are aware that some came back to residential care. Unfortunately, some even did not go to residential care. They went to the streets, but quite a number of children remained with their families, and that is work. Currently, I'm aware that Children's Services and the council and the directorate are doing a rapid assessment of where all these children are, where are the children in institution and the rest where they are in the community. We know it's going to take some time, but those are the questions we are asking. But just to conclude and say that we do have now a new Children Act just signed on 7th of July by the President, quite exciting. And within that, there is high provision about transitioning to family care. So all this is coming together. Just as I said, before COVID, we started the process again to gain momentum, and this has culminated in the new act being enacted. Thank you so much.
Thanks so much, Catherine. We're running a little bit short of time, but that was a fantastic introduction. And I think what it was demonstrating to us was a lot of the positives that have come out of COVID and changes, like new linkages with social protection that are emerging from the pandemic, but also I think the value of if you have a strong care and protection system in the first place, it really helps when an emergency hits. I just wanted to check really briefly if Arnold had anything else he would like to add, and then we'll wrap up with the last two lessons. Arnold, did you want to add anything to what Catherine and Khadija have said? Oh, okay. I will assume that Arnold has nothing else to add from those comprehensive presentations. Thank you so much. And I'm just going to talk as quickly through the last two slides. And if anybody has any questions that you want to ask, we'll have 5 minutes at the end for questions. So please do type them into the chat box. So the 9th lesson that we learnt was around support for mental health and well-being is really critical for ensuring the better health of children, the better care of children. So COVID-19 put a huge strain on the mental health of both children and caregivers, and of course professionals that were working to try and support them. And it illustrated how the threats to mental health have a huge impact on children's care. So for example, they were a driving reason behind the increased levels of violence in the home, that families were so stressed and really struggling to cope. And also this risk of social worker burnout and social workers really struggling to do their jobs because they were so exhausted. So it really shows that those key linkages between mental health and children's care. And the pandemic also provided lots of promising practice examples for improving mental health. So, for example, around the importance of explaining a pandemic or other emergencies or other rapid changes to children to try and reduce their stress levels so they have a better understanding of what's going on, and providing some tools around how to do that. The importance of giving practical support to caregivers, such as activity packs that they can do with children to help keep them occupied and to kind of reduce some of their burden, and some strategies for caregivers to help them deal with stress. And the importance of incorporating mental health very strongly into case management processes and providing extra training for social workers and others around mental health. Okay. And just to try and draw all of this together into some conclusions, I think we can see two likely scenarios in the region regarding children's care. If we do nothing, if we don't invest further in children's care, I think there's a real risk that children's care will continue to deteriorate as it has deteriorated during the pandemic. But if we use learning and reduce the changed attitudes towards residential care, if we use these opportunities from this learning and these changed attitudes and invest wisely in children's care, then we can see that this is an opportunity for care to really improve. So we're kind of at a turning point, I feel, in relation to children's care in the region. The pandemic has really confirmed the importance of a system strengthening approach. And those of you who are not familiar with this approach, there is a paper on it that we can share with you. And I think Bertha's been sharing with you some links where you can find all of our key resources. This confirms the importance of this approach, particularly of gaining an in-depth understanding of context, a stronger focus on collaboration and coordination, making sure there's a well-trained, well-equipped workforce, the really vital role of extended families and communities in children's care, the importance of working across sectors, so there's linkages between education, health, social protection and care, making sure that there are a range of services in place, that children have a range of care choices, and ensuring that care reform really emphasises prevention, but also that there are steps in place for safe reintegration. And we really have an opportunity now to build on some of the strengths revealed by COVID-19 responses. And I think they were confirmed across all three of the countries that were included. Learning how to work remotely, learning for the learning that we've had for future emergency preparedness and response. Also build on their real incredible determination and adaptability of those working on care, the social workers, the policymakers, and the great resilience shown by children and families and communities. So all of those factors are strengths that we can build on. So I'll wrap up there. There's a couple of questions, there's a few comments in the chat box and a couple of questions. So I'll start off with the comments. There's one just highlighting the importance of having very strong positioning on residential care that's in place so that we can ensure that we have very clear messages around the use of residential care, and that we can make sure that we are responding appropriately to residential care. There was also a comment around from the Ministry of Gender and Community Development and Social Welfare in Malawi from Stefano. Thanks for joining us, Stefano, about how other child protection concerns as well as care issues, children have become vulnerable in other ways around a massive increase in child marriage and early pregnancies as well. So I think all of those factors have an impact also on children's care. Also flagging, Stefano, a problem that was apparent across the region around how remote learning was really affected by the lack of devices that people had, but as we mentioned earlier, also data bundles and poor network coverage. And I think the conclusion for many in the region and elsewhere in the world is this remote learning was almost completely ineffective for some groups of children, some pockets of the population, because of the lack of coverage and the lack of ability to use those devices, and perhaps even the lack of space to learn within their homes. And that again has a huge impact on them dropping out of school, which we know has big ramifications for children's care. So thank you, Stefano, for raising those really valuable points. There was one question in here to, let me find it again, to Barbara, around how you manage to deploy government social sectors, social workers in this. I'm not sure I fully understand the question, but how did you manage to deploy social workers by government social sectors in their payroll? And is there any work regarding the revision of the social work curriculum to include the care of children? So Barbara, do you want to come back and add anything on that?
Sure, just really, I guess, clarification. I think we, as CRS, we did not deploy any social workers, but rather worked with the government workforce within their own capacities. And our role was really just to facilitate them to better carry out their mandate and support remote work wherever possible. I don't know if that answers that question.
Thank you. Yes, I think it does. Thank you.
In terms of the social work curriculum, we did have not so long ago, CRS in partnership with UNICEF and other actors and the National Council for Higher Education did go through a process of revision of the national social work curriculum. They went through a process of standardization to ensure that all the universities provide the same level of quality and depth for social workers going through higher institutions of learning, so that everyone comes up with some sort of the same level or same standard of qualification when it comes to social work. So that's, I don't know if that answers that question.
Thank you. That's great.
Yeah.
Thank you so much, Barbara, and thank you to all of the panelists for joining us today. I think we've really learned a lot from your contributions. I'm going to hand over to Mona now just to wrap up the webinar, and as luck would have it, our next webinar is around workforce strengthening, so Mona can tell you a bit more about that. While Mona is speaking, I'm just going to ask you all, if you can, to please complete a couple of polls, because it will help us to really understand who's on the webinar. So I'll just launch those as Mona is speaking, and you can fill them in as she's talking. Okay,
Thank you.
Go ahead,
Thank
Mona.
Oh, sorry. Thank you, Emily. I think we can all see the question.
Yeah,
with some
hopefully.
Options.
Yeah.
Yeah,
Thank
I can
you.
see it from my end.
Good.
Yeah.
Go ahead.
Thank you all very much. This has been a very informative webinar. COVID-19 indeed has derailed a lot of progress made on child protection, including care. And in this time, we are also seeing, we call it the triple crisis, COVID-19 being one, but also we're experiencing climate change, especially in the Horn of Africa, and also conflict in some parts of the region. And all these have a negative impact on children, and particularly their care. I would like to thank all the presenters, to echo Emily's words, to thank all the presenters who shared knowledge and experiences of how they managed to go about their care program in times of COVID-19. And, there is a way for you to join a mailing list. I think that link has been shared. So please register there, but also for the UNICEF staff, I'll be sharing the monthly newsletter with you with all this great information. I'm not sure if, Emily, you managed to address the question if there's a global definition on kinship care. And there is one. I've seen one, on Better Care Network's website, and maybe we'll post a link, to a paper of the definition being used. But basically, it's about kinship care is the full-time care of a child by a relative or another member of the extended family, and it's mainly informal in most parts of the world. Let me pause there. I don't know if you want to share the results of the question.
It's just come up. Thank you. And I'll just hopefully stop. Yeah, that's great. Okay, great, brilliant. Okay, yeah. And yes, sorry, I missed that question on kinship care. I'm just going to do another quick poll, and then whilst you're continuing talking. That's great, sure. Mona. Thanks.
Sure. Wonderful. We're almost there. So with that, we will share, of course, the webinar recording and the slides have already been posted on the page, but then through our newsletter, you'll be able to see more about this webinar. Okay, there's another question.
Yeah, just a
Where
quick
do
one.
you work? Okay. And I also would like to thank Emily for organizing this webinar, for reaching out to all the speakers that we had today. And we are very much, we appreciate all the work that you're doing, Emily, in this partnership. And also thanking Changing the Way We Care, we are collaborating together on this page. Just a quick announcement about the next webinar. This webinar is going to be on workforce strengthening, and we will also be having French translation for the Francophone speakers. Feel free to join us because there will be simultaneous translation. And this webinar might either be on the 7th or the 14th of September, and it will be facilitated by Changing the Way We Care. So we'll share more information in the next newsletter that will be coming out in September. We're going to take a little break in August, but nevertheless, we're completing some of the documentations that are pending, and we're excited that we will be having, we would have completed a paper and video on COVID and care in East and Southern Africa. So we'll be sharing that in our next newsletter. So with that, I thank you all, and I wish you all a very good afternoon. Thank you, and goodbye for now.
Thanks, Mona. Thanks. Goodbye, everyone.